So I'm reviewing the AliveCor KardiaMobile 6-lead EKG. I was having some heart issues, and when I went to the cardiologist, he pretty much said, I could put one of those Zio monitors on you for 7 days, but if you have a good week and you don't have any symptoms, it's not going to show anything. So he recommended the KardiaMobile 6-lead EKG. That way, if I'm feeling fine, obviously I don't have anything attached to me, but then if I was feeling the palpitations or any issues, I could use it in that moment and it would record my EKG. And he was okay with me sending him like either a screenshot or sending him the recording of the EKG so he could take a look at it. Obviously, you'd want to ask your own doctor whether they do that or not. Some of them probably would just ask you to go to the immediate care or the emergency room if you're having issues. I'm a nurse, so I think he kind of knows that I know when to go to the doctor and when not to. So obviously, if you're having an issue, go to the nearest emergency room or call 911. So this is the box that it comes in. I personally just kept it because I didn't feel like buying anything extra to store it in, but they do sell carrying cases for it as well. So super thin and sleek. I found out afterwards that it doesn't have to be charged, which is wonderful. I believe it comes with some type of, cell battery, and I've had it for a while now. It hasn't died, so it's great. So the way that you know you're using it correctly is it has kind of like a little A. So when you're having it on you, when you're recording it, make sure that A is facing you. If you're facing it and it looks more like a V, you have it upside down. So the way that it explains it is you want to use one finger on each of the top silver things, and on the bottom, that silver part needs to be touching anywhere on your left extremity. I tend to find the best reading on the lower part of the ankle, but you do have to kind of maneuver it in a weird way so that everything's touching at the same time. If you're not as flexible, you might want to pull your pants up and use your left thigh like that. But I'm just going to show you how I do it. So I don't have my phone because I'm recording with it. So in general, you're gonna press, start the EKG. You're gonna make sure your phone is on Bluetooth so that it can connect. It is super simple to hook up. It took me less than 3 minutes to get it hooked up. So what I do is I usually set my foot like this, and I'm gonna put my thumb on one side and the thumb on the other, and then just kind of hold it down on my ankle or on my leg like this. You have to try to stay as still as you can. And the phone will light up green on each of those connections when it tells you you have good connections on each part. And once the 3 parts have the best connection, it'll start recording the EKG. Every time it starts recording, probably the first couple seconds, it's going to be really fuzzy and blurry. You're still doing a great job, just hold still. It takes about 5 seconds, and all of a sudden it'll start clearing up the image and you'll see the normal EKG. So I believe it records for about 30 seconds, and then afterwards you can review it. If you do not have a subscription, it will just give you some basic information. It'll tell you whether you have a fast heart rate, tachycardia, a slow heart rate, bradycardia, or normal sinus rhythm, which is just the normal rate and rhythm. If you pay a subscription, to have doctors look at it, or it will detect AFib and some other abnormalities, but you do have to subscribe to pay for extra. So that's something to take into consideration, whether you're able to send this to somebody to take a look at, because if you don't know what you're looking at, it will be pointless, or if you don't have a cardiologist to take a look at it. So for me, this was a perfect thing. I like it because, anybody can also use it. My daughter, says sometimes that she's having some palpitations. So you can put a guest mode on there, and then they can check their heart rate as well. And you don't have to save it under your information. The app that it comes with is under AliveCor. Super easy to sign up. Like I said, it'll kind of try to sell you some things, but like the subscription, but it's not annoying. And the app has different things you can keep track of. So it'll have your history, you can see your last couple EKGs, and kind of trend them. You can tag notes in them like before coffee, after walking 30 minutes, you know, that way you can track like when your symptoms are happening. So I highly recommend this. You really just need a smartphone to hook it up to, and it's super convenient. So if you're having any issues, or if you're just curious on what your heart rate and your rhythm is, I would 100% recommend this. All right, thanks for staying with me. So you will select EKG and then add a new event. You will use your left thumb on the left silver palette and the right thumb on the right palette, and a left extremity on the bottom, either your ankle or your left knee. They will start glowing green like this once you have a good connection. Sometimes it might bounce back and forth. Here's where you see that it'll be a little bit fuzzy, and then the longer you stay still, it will start clearing up and make a crisp and clean EKG for you guys to take a look at. So we wait about 30 seconds. At the top, it'll tell you what your heart rate is and how much longer you have to hold until it's done saving the image. All right, we are almost done here. Once it's done, it will tell you what type of rhythm it collected. It could be the fast heart rate, slow heart rate, or an abnormality. It lets you know that it does not check for heart attacks, so please call 911 or visit your nearest emergency room if you're having issues. You could save it, tag it, change the person that you're saving it under so that you can go back later and take a look at it.